Well, we know that cases of the flu and other respiratory illnesses are on the rise. Health experts say our urgent cares and doctors' offices are seeing more and more patients. Everything from headaches and sore throats, fevers, congestion, of course, fatigue. Here with some important information for us this morning is Dr. Zach Kegley with HMG Primary Care at Meadowview. Dr. Kegley, thanks so much for joining us today.
Yeah, thanks for having me. It's a super important topic right now.
It is, and we are definitely seeing that spread. Do you know where we are right now, sort of in that peak? I feel like we all had the Christmas, we were all together. We sort of saw that exposure increase.
Right, yeah. Week after week, numbers are going up right now, and I would anticipate that to continue at least into January, February. We're going to see flu cases all the way up into April. So we're definitely, as people come home from the holidays, go back to work, go back to school, we're still going to see those numbers go up.
And that's kind of the scary thing too, is now we're kind of getting to that point where come Monday, a lot of schools are going back to classes, and a lot of students will be there, and then you've got families going back to work.
Yeah, absolutely. So it's a big time to stay on top of it, do what you can do to stay healthy, recognize the signs when you feel like you're getting sick, and try and protect yourself and others from getting the flu.
And it seems like we're seeing a couple of different strains in our area.
Yeah, flu A and B. Right now, flu A is the predominant one. That's the one nationwide, really, that's testing most often.
Okay. And when we talk about exposure, what can we do if you get that phone call or you realize someone in your family or someone that you just had dinner with for the holidays now tested positive for the flu? What should be your course of action?
Sure. If you know you've been exposed, the first thing you want to do is watch for symptoms. It takes about a day or two before you start having symptoms if you're going to have them. And you're going to look for fever, chills, the classic body aches, soreness with the flu, that kind of I'm just tired and sore everywhere, everything hurts. It's a respiratory illness, so you get the cough, the cold, the sneezing, the runny nose, that kind of stuff. You can have some GI upsets, so nausea, vomiting, diarrhea, those things as well. You can have some taste and smell issues, more commonly with COVID, but also with flu. So you want to keep an eye on that. If you start feeling those things, you want to get tested, because the treatments that we have for flu work best when they're started within the first day or two of symptoms.
So it is one of those things where even though it's a virus, you don't want to ride it out. You want to get tested to make sure you know what's going on.
Right, absolutely, because the treatments can shorten the symptoms, maybe help you not get as sick and end up in the hospital or emergency room.
And that was my next question. Who really needs to be careful when it comes to the flu?
The people that we think about are on either ends of the age spectrum. So really young people, less than 6 months, because they can't have the flu vaccine yet. And then people who are older, 65, are at higher risk. Anybody with chronic lung disease like asthma, COPD, diabetes, heart disease, anything that's going to lower your immune system, like active cancer treatment, chemotherapy, an organ transplant that you've had in the past. So people who have lower immune systems are at risk too.
And if you've been diagnosed, how long should you stay away from people and stay home so that we're not contributing to that spread?
Yeah, so in general, you can be contagious for up to 5 to 7 days with flu. We think about the day 3 being the most contagious of symptoms. Some good guidance would be if you've been fever-free without medicine for 24 hours, so no Tylenol or ibuprofen or any of that, and you don't have a fever for 24 hours, and you're feeling better. At that point, you can kind of go back into things. You won't be as contagious.
All right, certainly some good information. What about a flu shot if you haven't had a flu shot yet?
Yeah, absolutely. Anybody over 6 months, we recommend the flu shot. It's not too late. You can get it now at your doctor's office, pharmacy, wherever. We recommend everybody get it to help reduce your chance of getting the flu, but most importantly to keep you from getting really ill and ending up in the hospital with a severe infection.
Yeah, seeing a lot of that as well. Certainly some important information. Thank you so much for joining us. If you have other questions or you would like more information, you can always go to their website as well. That's HolstonMedicalGroup.com.